Repealing and replacing Obamacare has been a legislative priority for the Trump administration and the Republicans in general. The question remains about what that replacement will look like. Our next guest came up with his own plan, Kentucky Senator Rand Paul. Good to see you, sir. Thanks so much for joining us.
Thanks for having me.
So you have outlined the Obamacare Replacement Act to provide Congress with a health care plan which has conservative reforms in it that you think is ready for immediate vote. Tell us about the plan.
Well, what we did is we looked through a lot of legislation. There's been legislation out there for 10, 15 years that includes market reforms that most Republicans are for. I would say ours is the consensus plan. There's not one item in our plan that I think a Republican would object to. We legalize the form of sale of all insurance, meaning that we get rid of the mandates from Obamacare that prevent the sale of inexpensive insurance like catastrophic insurance. We help people save for their insurance. We let them pay for their premiums and their deductible in a health savings account that's tax-free. And then the third thing we do, which is a great idea that's been out there for at least a decade but has not ever come to fruition, is we allow individuals to join together in an association to have leverage to get lower prices and also to get protected against insurance companies dropping them or raising their prices.
Yeah, and the other thing is that you're protecting individuals from pre-existing conditions, which of course has been a critical part of what to keep in the current plan.
Well, what we do is we have a 2-year enrollment period under which that regulation would still be there, but it actually would phase out over 2 years because you can't let people buy insurance after they're sick, or no one will buy it before they're sick. And that's part of the problem of Obamacare. Right now, young, healthy people are not buying it even with an individual mandate. And what I've been telling my colleagues is when you repeal the individual mandate, but you still tell people they can get insurance after they're sick, it doesn't work as a business model. Blue Cross of North Carolina lost $400 million in the individual market precisely because people are not buying it before they get sick, they're buying it after they get sick, so they get what's called adverse selection in a group of very sick people. We can't have that, or we're not going to have a functioning insurance market, so we do have to change the rules back towards what the marketplace would dictate.
Tell us how it differs from some of the other plans out there, because, you've got Senator Susan Collins, Bill Cassidy, Shelley Moore, Capito, and Johnny Isakson introducing the Patient Freedom Act of 2017. You say that you think that your plan is really the one that everyone is getting behind. Are you going to be able to come up with something that will, in fact, be something that everybody gets behind? What do you say about Susan Collins' plan?
The problem with the other Republican plan is that it keeps your Obamacare taxes. I don't know of any Republicans, and I've traveled the country, I've yet to meet a grassroots Republican who says, oh, let's keep Obamacare taxes. And it also says, their plan says that if you like Obamacare, you can keep it. So if the big blue states with large populations like California and New York want to keep Obamacare, they would ask Texas and Alabama and Kentucky to pay for it. That's a non-starter. I don't know of any Republican at any grassroots meeting across the country that would say that they want to pay for Obamacare for big Democrat states. So I think that one's sort of a non-starter. It's Obamacare light, and I don't think really it is a consensus position. The reason I argue my plan is a consensus position is almost every plan, including that one, has pieces of what I'm asking. Allow more freedom in the insurance market. Let people save and let people join associations. Their only complaint is that it's not going to continue some sort of big government subsidies for health insurance. But that's precisely what we as Republicans, I think, have been opposed to.
Yeah, and you also allow the purchase of insurance across state lines. Let me ask you about the cost of the plan. Last week on Mornings with Maria on the Fox Business Network, I spoke with Dr. Zeke Emanuel, of course, who was one of the architects of President Obama's signature legislation, and he said it has nothing to do with economic growth. And I argued it has everything to do with economic growth because it's too expensive for business and individuals, and as a result, they clamp down on spending elsewhere. How does your plan become less expensive and become affordable?
Our bill would allow the freedom and choice and competition of many different types of insurance products, but mainly we would allow the sale of inexpensive insurance. Obamacare made it illegal to sell inexpensive insurance because everything had to have pregnancy coverage. Everything had to have 10 or 11 different mandates. We get rid of those mandates and let the market sell what consumers want, and that will drive prices down. Also, when you pay for your care mostly out of health savings accounts. If 30% of the public or half of the public were paying primarily out of a health savings account, they would call their doctor and ask how much something cost, and you would force transparency by having consumer interest in the price, and it works. LASIK surgery, no insurance covers LASIK surgery. Patients pay for it. The price has gone down every year for 15 years.
Yeah. What's the timeline here? We're now not sure what kind of priorities you've got in terms of Congress. I know that you've got Obamacare as a priority, but do you believe you will repeal and replace in 2017?
I think it has to happen in the next month or two, because, see, they can't get to tax reform until they're done with this issue, because they want to do tax reform through another budget. We're doing this through, you know, the arcane rules of budget reconciliation based on a budget from 2017. That process has to be finished before they can start the next budget process, which we need to be immediately in. So there is pressure to go ahead and vote on repeal. And what I've been saying, and I think the president agrees with me because he told me he did, I think Tom Price agrees with me. I talked to him yesterday morning that we should do repeal and replacement the same day, and the replacement ought to be market type of reforms that unite us all, not sort of big government or Obamacare light proposals that divide us.
Yeah, and that's what we're going to be talking about, by the way, the tax reform package with Representative Jeb Hensarling coming up in the program. Senator, it's good to see you. Thanks so much for joining us.